diseases?
Well, in daily life, it's just everywhere. My teachers got chikungunya several times, and some of them have got dengue. My grandparents have gotten dengue. None of them died because of dengue, thankfully, but my great uncle did die because of an airborne disease in a hospital of an unrelated thing. He had a heart attack. He went to the hospital, and even though this was a private clinic, because there's exactly no way to maintain them because there's no equipment. This is all about how the economy has affected hospitals. There are infections within hospitals because of lack of maintenance, and he got this airborne disease and died.
Yeah, and those would be diseases, I suppose, that we would think are treatable with antibiotics and different kinds of medicines that we get, but they don't have access to those medicines anymore.
That's right. We don't have access to those medicines. And, if I were, and I have tried to buy medicines for my family, they also regulate you how much you can buy, when you can buy them. It's extremely hard to obtain them. And that's the biggest reason why my grandparents also left Venezuela, because God forbid they had contracted any disease in Venezuela, they could have easily died.
Now, Anna, just going back to you for a minute on the childhood diseases. I mean, I think a lot of us think about, for example, when you send your child to school, right, you expect the children in the classroom to be vaccinated because otherwise it's a big germ factory. We know little kids are big germ carriers. So what is happening in the school systems in Venezuela? I mean, I'm assuming these children who are not vaccinated are showing up in school. You can have major outbreaks in that environment, I suppose.
So in general in Venezuela, there's been a lack of access to vaccines, as we've been talking about. And so that means that vaccination rates across the population have started to go down. And anytime that happens, we have the risk of an epidemic and diseases like measles coming back, or diphtheria. So for example, diphtheria hadn't been reported in Venezuela for 24 years, up until 2016. And now since then, there have been over 2,000 cases, including cases now spilling into neighboring countries. Similarly, with measles, Venezuela had effectively cut measles.
How difficult is the water problem in Venezuela right now?
Well, it is so difficult that my aunt that lives in Caracas still, she had to move out of her building for both safety reasons and also because there was no water and no electricity, and she lives in over 10 floors high. So she moved out of her building and she's living with a friend where she can actually have access to water somewhere else. You have to buy trucks, you have to pay in the black market dollars like Javier was saying. And the reality is that this has been, I could see this coming, my family could see this coming, everybody who's, who knows about the situation could see this coming from several years ago. Back when I moved in 2016, we had weekly water shortages and also electricity shortages.
Right. Yeah. Javier, you were mentioning that because of the currency problem, I mean, the fact that Venezuela basically used to pump oil, sell oil in the international market, get dollars from that, and then use that to buy a lot of their food from abroad and to buy medicines. But having said that, would you say that could be a main problem for the government, right? Because they have to import food. People are starving, and as you point out, I mean, food probably comes before medicine, right? Because you need it on a daily basis. But if the government wanted to do, say, a public health program, say they wanted to deal with this diphtheria problem, which is you can vaccinate for that, right? Say they wanted to deal with that, they would need the hard currency to buy the field.
Well, I would agree that yes, there's been a loss of dollars because of the the oil price drop and those things. We haven't seen these kinds of humanitarian crises in other oil-producing countries that depend on their food from abroad. No,
but I'm not saying that it was caused by the drop in the price of oil. I'm saying that it was caused by the destruction of the oil sector, the corruption, the mismanagement of the economy, and so forth. But in the end of the day, I mean, there was just some new numbers out yesterday about the amount of oil that they're pumping, and the oil output has gone down a lot. So they don't have the expertise, they don't have the infrastructure, and they don't have the money, or they don't want to spend the money on trying
more
to
importantly, they
deal
don't
with
have
these
the
vaccines.
honesty to recognize that these things are happening. They're in the old school of Soviet-type dictatorships that are lying about what's happening there. North Korea still today. I mean, we run by the numbers that we agree that probably happened. Of the crisis that has been produced in North Korea. 70,000 people or 700,000 people that died in the 90s.
Right, to other people, and So it becomes a bigger and bigger problem.
And Mary, I think that this highlights that the crisis in Venezuela is not just an economic issue of Venezuela or a humanitarian crisis of Venezuela or even a national security threat because of the terrorist groups that are there. But this is a global health crisis that could come because of the system in Venezuela. The Maduro regime could not only destroy Venezuela, but could destroy South America in a different way.
And besides the malaria, what other kind, have you seen
Cooperation. And I think there are some promising signs that have come out recently to indicate that President Maduro is willing to start to engage more in these international dialogues and receiving humanitarian aid,
And
which
do you
has
think,
been
Javier,
requested.
sorry.
I say the scientific community has also been very vocal in expressing the need for these kinds
Actually,
of
if you let me say something, Mary, first I would say that, you know, the Maduro regime, not the president, the dictator, I don't think that he really cares about what happens to the Venezuelan people because he would have done something about it before. This is about the socialist system that allows them to steal. And while there is still money that they can steal from the population through, you know, the currency control system, or while there's still money that they can do from drug trafficking, keeping the population oppressed and in their homes is the best strategy they can do to stop them from protesting.
And Javier, do you